You want to have to talk about it or?
Hey, Matt, I'm gonna go take 1 minute to see if I can find Mike. Not here.
Mike said he's gonna be a little bit late,
Okay,
so just yeah, that sounds good. I mean,
be right back. We're gonna start a couple minutes late anyway, right?
we just let it be. They don't want to come, you know.
Okay.
And your interpretation, he did email shortly. So as soon as that happens,
Just stay up and sit on the corner. Like, is there-
Yeah.
this is really.
Like that. Thank you.
Maybe just wait another minute or two for people to filter in. You're gonna take this.
For now, yeah.
It's great shape.
Yeah, thank you.
Hi, everyone. Good afternoon. Good afternoon. Thursday at a conference, everyone's happy, right? Thanks for joining after lunch on Thursday. So we're gonna talk today about developing an evidence-based WASH implementation reporting guidelines. That sounds really dry, but we're gonna try to not have it be dry. So as we go through this session, I want to kind of get at two things. One, I want you to know by the end of this session or feel in your bones that the lack of consistent reporting is a problem for this sector. So I hope you come away with that. And the second is that we should do something about it. Okay, seems reasonable in an hour and a half. I want to mention this work is driven by a core team of myself. My name is Matt Freeman. I'm a professor in environmental health at Emory University. Johnny Crocker, who's assistant professor also at Emory, and Emily Ogutu, who unfortunately had to leave the conference early. And so we are going to present some of her slides, but we also have a core group of advisors, some of which are here, but we did not ask them whether we could put them on slides. But Ben and others from World Vision, CARE, SNV, and RGHI are helping to support this work. And then I hope by the end, you will all want to also support this work. And we have a QR code at the end for some follow-up work that we're going to be doing as part of a Delphi process that I'll explain. Okay, so a few quick session outcomes. Number one, we want to talk about and learn about the current state of WASH context and implementation reporting in the literature, the key gaps, and how we can improve measurement in research projects, but also programmatic delivery. We want to contribute towards standard guidance documents and an associated checklist that will help the sector harmonize what we know about implementation delivery, and also really catalyze learning. And third, we want to build this network of contributors, you all, and understand from the practitioner, researcher, policymaker perspective, what do we need to do to make this actually work? Not just be another document that sits on a shelf, but something that's actionable, usable, feasible, okay? And feel free to interrupt, raise your hand. We're not going to do breakout groups. We are going to have some discussions, but no breakout groups, so you don't have a chance to run away. But feel free to make this a bit more informal and ask clarifying questions as we go. All right, so first, why? Why do we care about the state of implementation reporting in WASH? Well, WASH, as we've heard in many talks this week, is influenced by context. Oftentimes, context appears as a large box and it says context, and that is all. And context is important for us to understand. We may not be able to ever say this context component is important everywhere, but we can say what context domains of context are useful. And then that requires us to actually be able to communicate what that means. Issues around implementation fidelity, infrastructure, that these are not clearly reported in the literature. So as a result, we have an unclear understanding of intervention components and delivery. We don't know what organizations actually did. That limits our accurate interpretability and comparability between studies. So if ultimately the question for us is what works, where, and why, is the lack of cogent and clear implementation reporting makes it very difficult for us to do that. And it reduces our ability to draw conclusions with strong external validity, right? And say, how do you adapt and scale programs from one region of Ethiopia to the whole world, to the whole country, to Kenya? So coordinated guidance on reporting standards for WASH implementation, including process and compliance outcomes, are required for us to communicate findings and also better learn. So I'm going to give a few examples just to get our feet wet. And what do I mean? This is all very vague. Question for the audience. What do you think the average effect of sanitation interventions were on sanitation coverage and use from the literature? Anyone have a guess? Small is not quantitative. Come on,
10%.
economist.
10%.
10%.
I would say effective about a year before.
A year before it fell. Well, different. Yes. So that's great. Time bound. 10%. Ben thinks 10. Do I hear? 1%. 1%. 1 percentage point. Okay, so we did a systematic review. I wasn't trying to quiz you as to whether you read this paper, but we did. It was. None of you read it.
1% read it.
1% read it. Okay, so we did a systematic review of the literature, and the answer is that of 27 studies in the literature, the absolute difference, so the percentage point increase was 14%. Use was 13% increase. Okay, that's somewhat useful. The grade, which is like the quality score, was very low and low. Why? Part of it, most of it had to do with the heterogeneity of the outcome, but also the heterogeneity of the exposure. In part, everyone measured things differently. So it's very difficult for us to actually say what this number actually means. It's nice to say 14%, But when you look at a forest plot, which this is a forest plot, that's our 14% improvement. All right, you have a nice, if you just say, well, 14% improvement in coverage from all sanitation interventions, that's great. So we say, well, we reached 20%, that's better than other people, or we reached 5%, that's worse than other people. But in reality, there was such variability across these interventions that we may not be able to benchmark your work in Somalia or rural Ethiopia against Benin or Ghana, right? So we have to understand how these projects work across context. And it may be more useful to, for example, look at CLTS programs, but the confidence intervals of these are so broad that we just can't really say much. We'd like to say more because we just don't know what was done in a lot of these studies. When you look at what was actually, they say they did CLTS. What does that actually mean? So we think that standardizing the reporting of these interventions would help us be able to parse what worked where and why, and whether our program was successful relative to this other one within the right contextual considerations. Who's heard of the Watch Benefits trial? So one of the reasons that they said that they didn't see an effect was because of intervention intensity. So this is actually in the appendix of the main of this paper, which I actually hadn't read until today. And basically said, Gene Humphrey said, intensity of contact was a key driver. Well, Peter Schmidt has a paper, 7 trials, 7 question marks. And in the end, he concludes, we don't really know much about the impact of sanitation health because of this heterogeneity, the heterogeneity of delivery and the heterogeneity of outcome. So we don't know the fidelity and adherence of many of these trials. And so it's difficult to make a broader interpretation. Oh, here's the table from that appendix from Jean Humphreys, and that she actually delves into the literature about how often each of these interventions collected diarrhea data, and also how often they actually met, and tried to kind of understand, could you parse this out? All right, just a few other examples. A lot of times we say we did community gatherings. Well, this is a picture of a community gathering. What was done there, right? What were the messages? If you're doing multiple levels of interventions, household level, group level, community level, district level, like many of the implementers do, what actually happened at each of these levels? What was the modality of delivery? How many people were there? How often did you do them? What were they dances? Was it just information, right? Was there a performance? What did they perform? What was the messaging there? Was the messaging about just, again, about knowledge? Was it about motivation? Was it about modeling behavior? Oftentimes these interventions don't say that. They just say, we did a performance. We did a community performance. Doing some community mapping, right? That's a modality of delivery that we have. But what actually went into that? How often did you do it? How long did it take? Who was there? How many people were there? Were the leaders there? Or just the women there? Often we do household level delivery of some kind of intervention. This is showing a tool that we used in one of our studies in Ethiopia, our intervention in Ethiopia, where we talked about latrine construction, going up the sanitation ladder. It's very difficult to show this in the reporting of a study. We did publish kind of a very long, detailed guide as to what we did, but where does that exist in the web, right? Is it easy to find out actually what we did when you're trying to find out about our intervention? Just one final intervention, one final example. Work in Kenya. We did some modeling of making porridge with women. And this might appear in a study as we did a training, but in fact it's a very specific kind of training. It's modeling. It's a very different kind of intervention function than just knowledge generation, right? And so this might be some community gathering, and of course it's all very difficult to parse and to describe accurately what you did, but it's critically important so we can actually understand what was done at what level. All right, so one of the challenges we have is, what do we report too much or do we report not enough? And so one thing we want to talk about today is what level of detail serves the purpose of a universal guideline, to make sure that Ben wants to use this in his programs, and they're not like, wait a second, that is way too much information, right? So academics, we like way too much information, but we want to find a balance today, and we want to hear feedback about what's the right level. We think that by doing that, we can ensure proper interpretation of the results and promote comparability and replicability. So, kind of the end of my kind of hopefully convincing you that this is a problem and should be addressed. The development of standardized frameworks to report WASH implementation and widespread uptake by research implementers could yield several crucial advances. One, clear understanding of intervention components, comparability of implementation fidelity, adherence, and behavioral outcomes. And I want to point here, we're not talking about health impacts here at all. We're talking about just the implementation, right? We're talking about what we actually deliver. Evaluation of health impacts across interventions, that gets to the kind of meta-analysis part. How do we know that the syntheses across studies, across programs is useful, so that we know that the heterogeneity of the implementation is taken into account? Improved understanding of contextual drivers and considerations. Enhanced planning for key intervention strategies, and that's what I mean by, you know, modeling behavior versus knowledge versus restriction versus incentives. All of these things drive different levels of behavior, but oftentimes that detail is not reported. And finally, assessment of cost and cost effectiveness. Okay, so our goal is to develop and operationalize a gold standard, easily adoptable approach for how researchers, policymakers, and practitioners report the implementation and context of hygiene and WASH interventions to support comparisons across program studies and contexts. All right. We envision this just to be kind of a guidance document with a toolkit that implementers can use, with the goal of also having this available for a database that can be used to capture the different kinds of interventions, the different components within each. So I'll end there, see if there's any clarifying questions before Johnny talks a bit about what we've done to kind of scope the literature to understand the scope of the problem. Yes, you're right.
I would just say that, like, don't skimp on the last one, like the sort of the repository.
Mhm.
Like, maybe not to actually place it there, but at least where to find it. I think maybe that was like a big challenge for you. Like, for example, our study, which you kindly cited, we've got all of it. But I haven't looked in a while, but I think it might not be 2 clicks, it might be 6 clicks.
Yeah, that's part of the problem, and that's music to David's ears, that you want to have a repository. So that's, I think, in a way, you know, one of the underlying drivers of all of this is to, you know, get this kind of a database that can be usable. Yeah, Darcy, and then.
So I'm just thinking about how to operationalize this, and maybe you don't know yet, which is fair. But there's sort of what was planned before the intervention was delivered, and then what was actually delivered. Are you maybe the same checklist that's implemented kind of pre-post, or your thoughts on how it's going to work?
Can we keep that as a flag and something
It's
that
a great question, something we will bring up, but I want to add, so we're early in this process, this project, I'm very excited about it. It's going to keep going for a while, and we're at the stage of, we're not going to present you the checklist, the end result. What we're going to do is present you kind of the results from our lit review, some results in terms of what people are currently reporting. But you know, when we and others who are part of this project eventually write this up, this side event is going to be part of our methods section, right? So we're actually looking for you guys to help us refine this work and guide it. So that sort of question that you guys are talking about is what we're hoping for, so that, you know, coming out of this conference, we know what our next steps are.
When you look at studying clinical and public health literature, clinical guideline and community guide, what are the things that are different about WASH that tell us, hey, here's where we need to do something different versus one of the things where, yeah, what we said is probably a little bit different.
So sometimes when I think about my PowerPoint slides and I can tell if they're doing their job as if people's questions predict what's on the next slide. So good question. We're going to talk a little bit about that. So hi, I'm Johnny. I think I know many of you from prior work in the WASH sector. I started working in WASH in 2006 or so, and about 5 years ago, I transitioned away from WASH for a number of years, and I started working in implementation science, working primarily on health and healthcare related evaluations. And I really missed WASH and environmental health, and Matt and I started talking a little over a year ago, and I guess you could say Matt recruited me back into WASH, specifically thinking about ways to try to bring some of my learnings from implementation science into WASH, and this is, you know, one of the early initiatives that's part of that. So I'm going to talk a little bit about, you know, reporting guidance from other sectors from within public health. But just to introduce implementation science as a you know, a set of methodologies or a sector that we can learn from a little bit. It's a field that's fairly young, and it's a field that's very heavily filled with jargon. So don't be intimidated by implementation science. It's not as complicated as the language makes it sound. But the kind of the initiative behind implementation science is to develop standard language, definitions, guidance and methodologies around implementation processes and process evaluations. And in the field of implementation science, there are many guidelines, some of them very heavily used and that have really brought reporting of interventions in health and healthcare settings to a place where they're much more consistent and thorough and allows better comparison amongst them. Like Mike mentioned, there are some very obvious and then some more subtle differences between working in a healthcare setting and healthcare interventions to working in a environmental and WASH context and WASH interventions. Here's a plug for a paper that talks a little bit about the applicability of implementation science methods to WASH. It's a paper that Matt and one of his PhD students authored recently. So many of you might be familiar with something called the consort checklist. This is not directly relevant to the guideline we're coming up with today, but I'm talking about this a little bit to convince you guys that developing a guideline is worthwhile. It's not a purely academic exercise that's going to get lost in the literature after today. So the consort checklist came about, I think it was about 25 years ago now, as a checklist that guided people on how to report the results of randomized trials. And it's grown to have 25 items on the checklist, but it's had massive uptake. It was simultaneously published in 9 top journals. Over 500 journals now require that you use it when you're writing up a publication on a randomized trial. And it's been cited well over 20,000 times by people using it in their own publications. And, you know, just uptake alone isn't lead to impact, but there have been reviews, you know, more recently that have looked backwards at this checklist and its widespread use and have shown that it's really demonstrated an impact on the quality of reporting of randomized trials. In the years following the release of this checklist, a group called the Equator Network came out, and they were discovering that lots of people were now writing these guidelines and checklists, and it was hard to find them. So they basically just created a website where you can go and find all of these guidelines, and you can search and see if there's one that's relevant to you. And there are many checklists. You know, there's ones for how you conduct and report systematic reviews, how you can publish study protocols, observational studies, economic evaluations, qualitative research. The list goes on. But I think one of the main points is that, you know, when we started this project and we started looking at existing guidelines, pretty much universally, these focus on research methodology, outcomes, and impacts, almost nothing on reporting context and implementation. A small handful that have been cited, a lot less. But our attention did get drawn to one, which I hadn't heard of until this project, called the Tidier Checklist. Something about acronyms and abbreviations that they love that in implementation science, and they're really good at it most of the time. So this stands for the Template for Intervention Description and Replication, and I made it small so that you couldn't try to read it because that's not the important part here. But you know, following the consort checklist and all of these guidelines and checklists on how to report research methodology, some people came about and said, well, if the whole point of evaluating a program is that if it was successful, we want to do more of it, right? And so you find these publications and they're reporting successful trials, but then you go and try to do more of whatever that program was, and there's not enough information to replicate it, let alone adapt or innovate or improve it. And so they developed a 12-item checklist, and it basically says when you're reporting the results of a trial, you should include things like the name of your intervention, where it occurred, what it included, who did the implementing, who was receiving the intervention, things like that. And so this has had pretty good uptake and pretty good success. It's very healthcare specific in terms of how they define the terms and the types of examples and guidance they give on how to use that checklist. But we sort of used this as a starting point. We said, okay, here's 12 items. A lot of these are applicable to WASH, especially if we tweak the language and the definitions a little bit. We proceeded to look for other checklists, other guidelines and checklists, and we found a handful. Here's 4 of them that relate to reporting interventions, reporting behavioral trials, reporting implementation strategies, these larger scale evaluations. And we started to create our own table and said, okay, these different guidelines, are they telling you to report the same thing? Are they telling you to report different things? And we landed on 14 items that are common across those that they say you should be reporting when you're evaluating and reporting a program. I'm going to grab my water bottle. So I'm hoping you guys are somewhat on board with the idea that generating one of these checklists and guidelines is worthwhile for our sector. The next thing we did is we wanted to see, without guidance, there still is decent reporting in WASH. We want to see what does the actual current status look like. So we took these 14 items that are from the healthcare setting, and we came up with definitions that we thought we could use in our literature review in WASH. And so I'm just going to go through those briefly, and then on the next slide, what we're going to have you guys do is, we've been talking for a long time. We're going to start to get into the participatory stuff. We have a poll where we're going to ask you to go on your smartphones or your laptops or whatever, and go to a URL or use our QR code and rank these items in terms of what you think for the WASH sector is the highest priority for getting people to consistently report, and what's the lowest priority. And then we're going to, if the technology all works out, get the results up on screen for some discussion. So get ready for that in just a couple minutes. The first item is a very straightforward one. It's the name of the intervention. Rationale is the following one. I don't know if you guys can read this text because it's pretty small, so I'm going to just describe these. The rationale is, why the people doing the intervention thought it was going to succeed. This can be based on theoretical, conceptual ideas, or on prior evidence. The activities, this is what we often think of as the processes in WASH. What were the activities that occurred, procedures, the steps, including things that are work on in building the enabling environment. So not just community level activities. The materials that were provided, whether they were software materials, so brochures, handouts, posters, or if it was hardware, actually building latrines or building water supplies or distributing chlorine tablets, for example. Who implemented the intervention and what were their qualifications or background? Who were the recipients? I may use the term beneficiaries on other slides. I prefer recipients, but sometimes it's hard to catch it when you're doing your revisions. Delivery. So was this delivered at a household level, face to face? Was it in group setting? Was it virtual over the phone or via a video training? The context, which probably deserves more than one line. But what is the description of the setting where the project occurred? Dose, which if you're unfamiliar with that term, it's the amount of the intervention that people received. How often were people contacted? What was the duration of those contacts? Temporality is a fancy way of saying what was the start and end date. Targeting is a little more interesting. I think it's something that we don't see necessarily. The way it's seen in healthcare is very different from in WASH, but the idea is, was the intervention adjusted or tailored to the target population? And this can involve, for example, having a portion of the intervention that's different for ID4 households, or for, having a portion of a sanitation intervention that's specific to schoolgirls instead of the entire school. Adaptations. So this gets into, did the intervention change during the course of implementation? What adaptations were made? Fidelity. So there's a plan, and then there's how well you actually conducted that, and then outcomes. And here, I think it's worth reminding you that we're not talking about reporting the results, the findings of the trial, but if you have an intervention, what are the outcomes it's supposed to impact? So for example, we all know about sanitation behavioral trials. They often first target, building of a latrine and then use of that latrine. So those are intermediate outcomes. The ultimate outcome might be a health impact or a reduced exposure to a pathogen. So, is this study reporting what those target outcomes are supposed to be, regardless of whether or not they actually report the findings themselves?
Is that where you would put like data collection, sort of sampling, like data collection protocol, survey form?
So no data collection protocols or sampling are actually in this checklist here. Those are typically well covered by existing checklists and guidelines. It's very hard to get a paper published without reporting those somewhat well, just because of the, they're going to refer you to the consort checklist if it's a clinical trial, et cetera. One of the things, Matt, I wish we had done is we've all seen these causal pathways where you have your program inputs and then your outputs and your outcomes and your impacts, and then you have a big circle around it that says context. We're talking about the circle that says context and the little box that says inputs, and all those other things are very important to report, but they tend to be, there's a lot of existing guidance on how to report those, and whether or not that's guidance is followed is one thing, but we're not necessarily trying to redo that kind of guidance. We're focusing on those, the program itself and the context in which it was implemented. So a couple of these, in our literature review, we found they were always reported. Name and the start and end dates. So we put those in gray. You don't need to vote on those because whether or not you think those are important, they're going to get reported. I think they are important, but what's left is, I think we have 12 items here. And if you put in that URL, pollev.com/Matt Freeman, or if you're close enough, the QR code should bring you to a poll. Did you make it go live?
Live.
So you just put in your name, and then if you click on items, there should be a little up and down arrows, and you can just move things into an ordering. And the more of you guys that do this, the more interesting this discussion is going to be. So we're going to just give it a few minutes for you guys to fill this in, and then we'll probably I think we're going to let you talk to your neighbor about why you voted the way you did, and then we'll have people give their opinions. So I'll leave this up for a few minutes.
You can do it on a computer too.
Yeah.
We can help with any technical support, let us know.
Yeah.
It's not the most intuitive interface. You see it.
Yeah, do you want to vote? Is it working? Okay.
Hey, Johnny, can I ask a clarification? Do you want us to rank these in terms of priority of funding allocated or resources or time? Or because when you're saying like what should be prioritized?
Yeah, so prioritize
Like a
for
subjective.
like something that would be a mandatory to report. So let's say I see there's some people in this room who fund projects. Let's say that they tell all their grantees, we're going to fund you only if when you write this up, you include this information. So think about it from that example.
And
What if this information would be highest priority to be a required reporting item?
if our goal is to be able to compare programs,
Mhm.
what would we most really want to focus on in order to understand?
We tend to fund a lot of systems-based approaches. And that focus not just on the sort of what, but on the how and the relations of the connections and things like that. And I'm wondering how well this sort of approach is going to work for them.
That's a great question, point. I think what we'll get to towards the end is like, what are the bounds here? How do we make it broadly applicable, but not, are there some kinds of wash interventions, programs that are just not going to be relevant or require a different module? Or, how would we make it work for that? Or is it even reasonable? So that would be a question.
And I would think that the folks who worked on the USAID Sustainable Wash System, the CE Boulder, it'd be good to talk to them. And this does make me wonder if we're starting with from the right other sectors.
Yeah.
I mean, I know why health is, but I'm not sure that would be the right paradigm to start with. I don't know what the right one would be, whether it's education or something else, but sort of an interesting question. Whether, because this is still pretty helpish.
Yeah, it's useful. There is a lot of, I mean, there's a lot of health system strengthening work that utilizes these kinds of reporting guidelines. So it'd be useful to go back and make sure that it makes sense for our context.
And one of the questions we're going to discuss in a few minutes is, this is what we're reviewing from literature. What are we missing? Because we're not trying to use this as an endpoint. This is a starting point for discussion. And I think one of the things we noticed is that a lot of the discussion in Washington tends to focus on household and community level, where this stuff describes more thoroughly, but there's a lot that's missing. So, but I think we want to look at full results first.
Go to the next slide, I think. There we go.
Wow, that's cool. Oh, look at that. People are still voting.
Can you go back so we can see the definition before we get there?
Yeah. Is it, you guys, we've got one more question, so if you guys can hold your conversation for a minute.
See how one purpose is to make sure you can compare interventions and their outcomes. Scalability, you want to know exactly what happens so you can treat the results. So you want to do it more consistently. Then the other argument would be that if you start asking organizations to report on this stuff, they might start thinking, oh, what was our rationale in this? It's just that is good, but I think that would change where you rank these things. Like, if you want it as a tool to influence people thinking more carefully about what interventions they're choosing, then I would put rationale at the top. But if it's just a consistency, then I would put rationale at the bottom.
Yeah, that's a good point.
Well, I think that this exercise is really to stimulate conversation. That's it. Yeah, I mean, it's very useful. Why don't you go?
Are you guys good if I move to the results page? I'm really curious.
And so it'd be great to just hear if there are a couple people who want to further reflect on why they chose something, why it's different than what's up here.
Do you, I mean, if you guys want to talk to the people right around you for a couple minutes on why you voted the way you did, or why you think this is accurate, and then maybe we can have a few people.
Are you taking notes on any of these, like, points?
I get the impression that there's a lot of ideas here, and we could probably just let you guys discuss amongst yourself for an hour, but then we don't get to take notes on it. So we have a lot of things we still want to discuss. I'm thinking maybe just 2 or 3 people can give their thoughts on this quickly, for the next couple minutes, and then we'll move into the literature review we did to see how this is actually getting reported. Are there a couple people that would like to?
Sure, I think one of the things that I would comment on is that clinical trials come from very endpoints, sort of specific, so they're very projectized in the sense that they have a dose and they have a duration, and you're looking for a specific set of, measurable outcomes. And especially when you come from healthcare, it kind of is, is it better than current standard of care? So you're always going to compare the impact to something else. And I think a lot of hygiene interventions tend to be sort of virtuous spirals, right? They're continuous improvement processes. But I think when you look at this kind of language, as you pull apart the healthcare language, and you need to kind of think about that. A lot of hygiene interventions are going to be about continuous improvement, and we need to kind of take a lean or agile or other maybe language toolkit and bring it to this checklist.
Yeah, I the 2 mics here.
The mics.
I kind of didn't really rank it. I kind of put it in an order where I thought I would like to read it. But largely because, it's hard to kind of put a higher value on one without the other because they're kind of related to one another.
Yeah.
I don't like what's the sort, but you was just really pessimistically put it in an order where he was saying the first one would be the most reliable ones and credible ones, and the least ones.
How much I trust others to know what really happened. So I'd love to know about fidelity, but it's more, there's an unknown problem there. So like, when you tell me fidelity was low and here's why, that's highly valuable. When you tell me fidelity was high, but you don't tell me how you know that's accurate, what your quality control was, then it's kind of like, that's low value because I don't know if it's true or not.
Yeah. Do 2 more.
I'll tell you the girl thing why we bring things the way they did. I put dose as kind of really high up there, mostly because it's the part that nobody talks about. And it's ultimately kind of, it seems to be the missing link here. If you go back to that same systematic review that Matt was talking about the balance wash trial, kind of the intensity of contact with the intervention, effectively the dose, it really seems to be kind of one of the immediate things. And just thinking about things like, you can do an information session once every 2 years, or you can do it in, once a day with the same people, and those are going to result in very different outcomes. But if you're just focusing on the fact we did information sessions, it's going to be the same set of activities. But I think when we were talking about that in our little side group here, we started talking about how the fact that a lot of these aren't probably moving away from thinking of these independent variables, and what are here kind of some of the domains, and how can we maybe organize some of these things, because they were we're talking about how kind of that to them should be part of the cover standardly reported activities. So just that's.
Can I pick up on that just for a sec, just to build on that? Yeah, I think it's really important to come back to your point about the experimental design, because that dose is not just what was planned as the intervention, but it's also about the research. If you're going out weekly to collect data and remind someone, if you've been doing a hand hygiene, then that's going to be part of that dose. Or if someone's out there measuring water every week, it makes a big difference to what they see and how what that dose is in reality.
I was looking at this, and I hope if you're coming up with reporting guidelines that you'll find really different words for some of this. Medical project related, so like dose, like none of my grantees talk about dose when they carry out a project. But the other perspective I realized when I looked at this as with my funders hat on, like half of the stuff in here, I have been trying to, let's say, convince my future grantees that ought to be in the proposal if they want to get funded. In terms of the why do you think this is going to work? What's the rationale? What's the existing evidence? What are the the activities? All that stuff. And then what they eventually report on is not all of that again, right? It's actually a subset of what's in there. And maybe that's semantics in terms of how you break it down, but a whole bunch of what you want people to think about comes before what I see as reporting on what should have done.
Yeah, I mean, I was gonna say, I would want dose adaptation and targeting to be much higher at the top from a implementer standpoint. If my teams are telling me that things aren't going well, they want to change stuff up, I'm gonna say, change it up, like do something different to make it work, and then forget the protocol from the original side. Let's then measure or record what was changed. I think if, often in a research study, if we do have changes, that's missed in the end.
Yeah.
So I feel like those things have to come up to actually see what was done.
This, I want to make a small comment, 'cause this is making me think about one aspect of this is, so dose is very pertinent where we have behavioral outcomes and we're looking at behavior change. We're gonna get into the literature review in a moment. Some of those interventions only are provision of hardware, and all of a sudden they're not reporting those because they're not actually even necessarily having contact with the intervention recipients. Lewis's point earlier about, when you're doing systems thinking, maybe a lot of these fall away and we're missing some things. So it's interesting to see how people rank that and how that relates to maybe what their background is in terms of what types of interventions and whether or not these are important for one type versus another. I think that everything you guys are going to want to say is probably going to come up in a future discussion point. We've got a lot of slides and topics. I think you already got to answer one question, so. Okay, so I'm going to move into, I want to highlight the word scoping here. We were using those items and looking to see how frequently they were reported in the WASH literature, recognizing that that's not necessarily, that was not an endpoint, that checklist. And there's probably some things that it doesn't capture. So I'm going to show you the literature review. I'm going to try to preempt some of the questions by saying that this is just one way of looking at what's being reported, but it's not comprehensive. Maybe what we need to do is when we get to the end of this project, redo the literature review with our final checklist or our final guideline and see how it compares.
And we haven't yet done the gray literature review, which is, this is.
Yeah. So we were looking to try to understand what is the scope and scale of reporting context and implementation in the WASH sector. We're taking a narrow look because this was a rapid scoping review, so we weren't trying to be comprehensive. We're looking for any particularly exemplary examples of reporting. But for the sake of trying to be systematic and keep this from ballooning, we focused on the 40 most highly cited WASH publications from the last 10 years. And we sectioned that into 2 5-year chunks when we were looking at articles, because obviously the older articles are cited and we've been around longer. We had a fairly comprehensive search strategy, which gave us tens of thousands of hits, and then you we just scroll through them, or order them by citation count, and you scroll from top to bottom and pull the WASH ones until you get to 40. So a huge number of hits, but since we were limiting the number we reviewed, it didn't take forever. This is how those publications break down over the last 10 years. Somewhat of an even spread. More of an even divide across hygiene, sanitation, water, and multi-component interventions that targeted at least 2 of those than I was expecting. A lot of them had a hardware component, and specifically talking about some level of provision of hardware, whether it's a latrine or even just as small as a chlorine tablet. If something was targeting, like CLTS, and there was no subsidies or provision of materials, that would go into the software bucket because the intervention itself didn't provide hardware, even though it was considered an outcome. So the majority were some combination of hardware and software being provided, and then some that are just hardware or just software. And then we looked at the setting of these top 40 citations, the publications. As you might expect, the large majority fell into household or community setting. There are a lot of hand hygiene related studies that we might not see represented at this conference. They're from developed country settings and they're targeting hospital systems, but some of those showed up because they get highly cited in that sector. So, a chunk that were from the healthcare setting as well. And then a few that were more systems level, 2 out of 40 at this option was cited, and a couple that are at the school setting. And so we went through these articles and we had our definitions and some subcomponents, and we looked at, did they report this with sufficient detail? Did they report that with sufficient detail? And we'll show you the scoring of that now. And we did some color coding. We're not naming any publications because we're not trying to, that's not the goal here. And I discovered that mine didn't necessarily score so well either. I'm just going to go through a few at a time. And one of the things you'll notice is rationale here has 3 rows. And we discovered for some of these, that individual item, like Will said, the language itself maybe wasn't appropriate, or maybe there were more components that we had to look at in order for scoring. You can, so 0% means nobody missed it. I probably should have flipped and had that be 100%, but hopefully the color, you can look at the color instead of the percentages. Everybody reported some form of a name of their intervention. Almost universally, they were reporting some justification for the intervention and why it was suitable for the setting they were working in. Very infrequently were people giving a theoretical or conceptual justification. Things started to fall a little bit apart as you went down the list. So there was, a broad approach was reported very frequently, but the actual details of those implementation activities were infrequently reported, about 3/4 of the time. Similar for, any materials, any hardware or software that was provided, was there sufficient details to understand what that was? I was expecting the actual implementer to be described more thoroughly than it actually was. Sometimes their name, sometimes not, and sometimes some background on the experience or qualifications of that organization or facilitators was given. More frequently did we see information on the recipients of the intervention. That's usually your table 1, right? Description of the study population. Context we broke down into a number of factors because it was hard to distill it into one component, since there's enabling environment factors, description of the setting itself. Was better reported than expected. Dose we broke out into 2 components. You could break it out into more, but we broke it down into frequency or number of contacts with recipients, and then the duration of those contacts. I think we have that titled intensity, but it was duration. Temporality with start and end dates, everybody reported that. I'm hoping you guys don't recognize the actual quotes, but here's an example that got a 0 score on dose. You can't tell how many times there was contacts with the intervention recipients, nor can you tell the intensity or duration of those contacts. The extent in this publication and its supplements of dose was the word ongoing.
Johnny, just to point out that we went to the main paper, and then
Yeah.
also any supplemental report, like any links, we followed the trail as far as we could with anything that was like protocol paper or anything. So we read through to whatever documents were available.
Yeah. So
Including anything
the
on
search strategy gave us the main article, and anything that you could get with one step away from that supplement, support process evaluations, etc. And that's probably another discussion, is where should the information be located. I don't think we're going to be trying to get into that today. Here is a more thorough example where in the first point they're describing some duration of these events, and the second point they're talking about the frequency or number of events. In the third point they're talking about duration of another sequence of events. This got both check marks for both aspects of dose as compared to the first. So I'm just giving you a snapshot of what our review looks like when we were actually reading through these articles. Targeting was fairly well reported. Adaptations I didn't score here because we didn't think if a paper did not have adaptations, we wouldn't expect them to talk about it. That's kind of a thing that only applies in some cases. Fidelity, was it measured? And then if it was measured, what did the actual results look like? What were the target outcomes? And then again, I didn't score subsidies. We didn't talk about it yet, but that's something else we looked for, how frequently their subsidies reported. And they're not often included, and so they're not necessarily reported.
Yeah, Johnny, when you say QC on fidelity, how can you find that?
So was there anything in place to measure fidelity? Were they tracking that at all?
Okay.
And then if they were, what were the results of that
I know
tracking?
QC and then how do you know what you reported from the tracking?
Right, not. So, okay, so Matt and Emily and I looked at this chart after going through our 40 publications, and we thought, do we really need to be doing this guideline? This is actually, there's a lot more green on here than we were expecting. There's a few points. There's still within that a lot of inconsistency, because this is just generally, did they report something on this, not with how much detail or consistency. Another thing to note is, of 40 publications, only 2 of them actually got all of the check marks, excluding adaptations and subsidies, which we weren't storing for everyone. So it doesn't look bad overall, but there's very, very few projects out there that are actually reporting all of this. And again, this is not, does not necessarily capture everything it should be reporting.
And these are the most highly cited WASH papers.
Right. These are, we think these are most likely some of the best examples out there in terms of how thorough they are at reporting. They're also in journals that tend to have pretty thorough peer review.
Was there a single one that had like 90%?
There were two that had 100%.
Two.
I'm not gonna, I'll wink at some people maybe. The author of at least one of those is not in the room. I bet you can infer. Do you want to facilitate? We have some discussion questions. I mean, one thing we're curious about is there's, people in the room from funding organizations, policy organizations, implementers, researchers. Do your organizations have any internal guidelines or review system in terms of making sure that context and implementation specifically get reported? There'll probably also questions about the literature review.
I'm just wondering, for articles that like had a Concord or Strobe, checklist that in the supplementary material, did they get like perfect scores? Right, because I'm thinking you said it was the most highly cited paper, so some of them might have been quite old, that's why they were highly cited, because they're from 20 years ago or something.
We're only looking at since 2012. Yeah.
So I was wondering if these newer guidelines help address some of these concerns, or if there's still major gaps, because they don't perfectly overlap. So I was just wondering what you found.
Yeah, so like all except for a few guidelines do not say anything about what you should be reporting on context and implementation. And the ones we found, the tidier checklist, for example, I have never seen that cited in a WASH article. You guys can correct me if I'm wrong there, but I don't, those guidelines definitely improve the reporting in these articles, but not of context and implementation specifically. You see better reporting around things like data collection, sample size, outcomes, that sort of stuff.
How many of them had protocol papers, and did you refer back to those?
We were looking at first the main article. If it wasn't there, we would go to the protocol. If it wasn't there, we would go to the supplements. If it wasn't there, we would go to associated process evaluations or other associated articles. So we didn't look at those unless we needed to, but we included those every time there was one. So these results was it reported anywhere at all that you could find publicly available based on that first article?
We have a separate column that says, was it reported in the main paper? That's
Yeah, you can break this down into 5 columns based on where it was reported and how frequently in each location. And that gets to be too nuanced for now, but we plan on doing, this doesn't merit a full publication. We'll probably do a short write-up and share these results publicly along the way.
So yeah, I guess the question is, after seeing this, well, number one, like any reflections, but also for the folks that think about implementation. For the folks that think about implementation, Kelly, are you saying I was too quiet?
Yeah.
Oh.
There's a noise outside.
For the folks that think about implementation, how do you, in your organization, how does this kind of comport with what you try to do within your organizations, or if you're a funder, how does it align with what you ask folks to report? And do you have, do you have the existing internal reporting guidance? Do you think that your organization fully captures this? Where does your organization report implementation procedures if folks wanted to get a full protocol and then implementation procedures? And then in what way do they collect the data through, what kind of administrative data? I guess that's enough for now, in terms of throwing out to you. There's
Or other thoughts
yeah.
from what we've presented thus far. We're thinking primarily not about reflecting on those 40 articles, but thinking forward to if we're producing this kind of guidance, what kind of questions can we solve?
From my experience, like the consort and then the different sort of guides to pre-registration, they've definitely helped me like do better science, because you're thinking ahead, right? I'm gonna have to either now for pre-analysis plan or when I write this paper, I'm gonna have to have all this stuff in an organized way. So I think one way you could sort of help with take up of this is sort of show how this could help you, think through what it is that you're going to do.
Yeah.
And with some examples and so I mean it's a burden up front, but I find it will work better. And then you save time.
Peter, yes.
Days when we did demonstration projects, I don't know what that term is still used, which were intentionally designed to lead to an investment project. Then it would drive a much more extensive review of the implementation. And it would typically at least annual meetings to review implementation and some activities like Nicole. It was probably a quarterly visit, basically to ensure whether the initial design protocols were being followed, and if not, why not? Because of course, if you want to sort of justify the design of an investment project, you need this information further down the road.
That's helpful, Peter. Some of my experience with the protocols, the implementation protocols don't even exist, and so it's very difficult when asked to even do a process evaluation to assess fidelity to that implementation protocol. You don't know, like how many visits are you supposed to have? How long are you supposed to visit? Who's supposed to be at the meetings? That is missing. So it's good to hear that CARE had that. Any other? Darcy?
One of the things I'm wondering about is implementer training. I don't know if that's captured under your umbrella of implementers, but knowing, say, we recruited community health volunteers who were mothers of children under 5 in the community. We know who the implementer is, but we don't necessarily know if and how they receive training on how to deliver the intervention. Is that something that's included in there, or?
We were looking for that in the review specifically. If the training was part of the intervention, then they had to have the dose of training too, as well as describing who implemented and who received the training. Sometimes there are people on a project who are trained before the project starts. And if that's a previous qualification, we obviously weren't looking for it. But if the training was part of the program, then that counted as an activity and they had to report implementer, recipient, and dose to get the check.
Yeah, well, and then Mike.
Just to help you answer some of the questions you asked on the fly.
Thank you.
As a funder that across the organization, not just in the WASH strategy, funds quite a bit of research, I don't actually think we have strong guidelines for reporting this. We have very strong guidelines for sharing data, making it accessible, and we have facilities to do that for researchers to post their data. We have, open access guidelines, lots of stuff around accessing the research, but it's not necessarily about what is exactly reported. And so I sit here now thinking, I want to know. It's interesting to think about, like, to what extent you can meaningfully influence that.
Thanks. Mike and Layla?
Yeah.
Luke.
One thing I find really helpful is that it's very student either get information on language. So what language were things done in? What language, and was it the primary language of the people receiving it? Was it a lingua franca that everybody kind of speaks, but it's their third language? Or we don't know. And the folks doing the delivery said they're fluent in whatever language. Do we have some way of knowing they're actually fluent in that or not so much? To the extent that that's knowable, that's helpful.
Yeah.
Layla?
I have 2 things. One is like on the participants, I don't really know what you looked into, but I was wondering, we always talk about vendors and aggregation, like who was being targeted, men or women, were men involved, like in so many interventions, we find that if men are not engaged, things don't really happen, and so just thinking more about the details of participants, again, I don't know what you looked at. And then I guess I missed the very start, but I heard you covered costs and kind of so that cost wasn't included, but I feel like I don't want to just like drop that, because like we talk a lot about scale. And are you going to scale up an intervention? But we have no idea how much things cost, even though this is a research project, it costs more, it's not going to cost as much at scale. Like if there's no underlying like basis point for how much it costs, like how do we even think about whether or not this should be something that's scalable? So maybe adding something about cost.
I'm not sure why I didn't, given how much costing work I've done in the last 10 years. It's oddly lacking in healthcare research too. I think it would have been about 2 or 3% reported across our review.
So Osprey doesn't actively fund much research of this type, but I will speak to broader things. We've been approached often to fund data platforms, because everybody says that. And the core question we have is, what decision is that going to make? Is that going to change how money is spent? What happens? So I would hope that even if you seem to go as far as outcome, But it would be nice to know what the researcher thinks this is going to change in the way things are done on the ground. And if they can't answer that question, that's fine, but it would be helpful to know that. The second thought comes from sitting in on the session this morning with Michael Kemmer and Evidence Action and the Minister of Water in Uganda, where, you know, there's very good evidence, which Michael presented, that fluorination will, you know, reduce childhood mortality by 30% and $1.50 per person per year. It's very cost effective. And yet that intervention has not been adopted very widely at all, considering how great it looks. And I asked that question, some said, well, it's, we think about the health sector, not the wash sector, but a core question we ask all of our grantees is, where do you fit into the system? What is your, you know, what's the difference? What's your theory of action? What do you do? And, you know, for yourself, but how does that fit into the broader theory of action or broader theory of change about how things are going to get better? So it would be useful. I know that can be far away from this sort of research, but even trying to connect that hurt.
David, and then
Sure. So I think the thing is you need to also sort of include in your write-up is sort of what is the value of actually collecting the data, right? Is what is the value of the data set? And on my past experience in the manufacturing engineering kind of high-speed process control space, it's the creation of best practice is what you create from collecting the implementation science data, right? So in order to create best practice long-term, you have to collect enough of the underlying description of the improvement so that you can then sort of use, you know, future analysis to sort of identify which ones are the most effective. And I think that's really important. And then specifically in clinical trial design, that development allowed you to build things like adaptive trial design, so like Bayesian trial design. And you can't do that kind of stuff because it's not like you know, hygiene interventions or other kinds of wash interventions. In medical devices, you just let it fail, right? The trial just failed, you don't reach your endpoint, so you write that up. You don't do that in this space. I think that's very reasonable, but I think building a best practice so that you can get to adaptive trial design and get to better scientific results from trials you modify in the middle, or building modification in your plan using, you know, statistical methods is kind of that is a value in and of itself. And I think it will significantly raise the knowledge generation quantity per dollar spent essentially in this space.
And I also think based on what Raymond said before, also, just knowing that these requirements are out there forces you to think about them and measure them. And also, if you have to report on a protocol, it makes you write the protocol. And we're not talking only about trials here. We're trying to talk about all programs. You know, I think we probably all agree, all programs should have a intervention plan. And that should be detailed enough to answer all these questions. And you should be able to report on that. But a lot don't. Programs that are just development programs are also research programs. Can we do two more? Robert, did you want to talk? And then last one.
Sure, I kind of going back to the other slide where you have kind of the whole piece of it, I think something that it seems to be kind of slightly after.
Okay.
The
There you go.
there you go. Is something along the lines of intention and beyond kind of what a step beyond just the rationale. That's kind of why you're doing the intervention. If you think about kind of just limiting it to kind of here's the software, the hardware components, you know, a poster is a poster, depending on the content, is trying to do very different things. Or you know, building a hand washing station can be various, it's not just materials. Depends on where you place it, then kind of linking this back to some of the other science, this again coming out of a behavioral perspective of the intervention function, the behavior change techniques, where we do have these kind of very complex taxonomy. But something that I think could help link some of these domains together in a way that's
Helpful.
I would, to your point before, Johnny, you said that you omitted the adaptations. I would push back on that a little bit because I feel like if it's in something that you have to fill out and have to talk about, then it will come out more. So people may not, and then here's my, people may not report slight changes to the adaptation, because they don't feel like it's that relevant. But maybe it is relevant that you wanted to do, dose A and it didn't work because of some reason, so therefore you did dose B. And then, if you're not required to report it, then you can just leave it out.
Yeah, I think that's a good point. It's,
I mean, a lot of this is the difference between static thinking and dynamic thinking,
Mhm.
right? It's like, this is all built around a single intervention and that happens, but so much stuff that works is dynamic in the sense that it changes, as other people said, it changes over time. And if there's some way you can try to capture something about that dynamism and the fact that it's a continuous process, that would be very well.
That's very useful. Thanks.
And I think I heard a comment earlier about how that doesn't exist in healthcare. I just want to push back a little because my experience with this is doing this for routine healthcare programs that are ongoing led by government, and we're doing this tracking via government officials reporting their monthly activities outside of a defined intervention. So I think there is lessons to be learned there from other sectors too. Mike?
Yeah, first of all, I think it's useful. Kind of count the number of times that I've gone to something today. There's something important to what actually happened. What they're actually doing. Because at the end of the day, as practitioners, we don't have this kind of whatever, like, it's gonna be one or the other, and it doesn't matter the outcome, and as long as there's hope. I think at the end of the day, practitioners are like, it's gonna happen, it didn't happen, our questions are like, oh, there was something that went wrong. So figuring out what that is would be a useful thing, so that we can redesign and come back to it. The other thing that was kind of coming into my head was, if you guys do this, what are you guys doing for? Because I think the intention might change what you guys are trying to include or execute. And because the audience potentially is broad.
Right.
Yeah.
That's, and I'm gonna use that as a launching point to the next kind of section. We have about 15 minutes left. And the last question is that exact question. What's the scope? And before we get to that though, we have one more vote for you. If you go back on your phones, this one, actually after our discussion may not be as
You want to skip it or? So since we're short on time.
yeah, maybe we can skip it. I mean, I'll just say what we wanted to do here, which was, I mean, everyone's been so kind of proactive about discussing, we didn't hear a lot when I asked the question about what the organizations currently do. We didn't, and not a lot of people said that. So, I mean, the main point of this next vote was going to be what's feasible to collect. And I think something that seems like we might have to get into a little bit more is what kind of administrative data do programs collect that could be easily adaptable? And so it may not be worth actually kind of going through the which ones of these are feasible, because maybe they're all equally feasible or infeasible. But we might just need to talk more to the implementers about that. So maybe I'll hold that for a minute, because I think what's the scope of this is something Lewis brought up and Mike brought up that will be useful to talk about. Right, so with permission, I'll just go to this, which is the last little bit, just a few more slides, food for thought. We want to make this usable. There's a right size, right, where it can't be too much, otherwise no one will use it. Can't be too little, otherwise it won't be useful. There's Goldilocks problem here, so we want to scale this so that it's usable. And Willem, you talked about the language. I think that's something we really need to think about. But I will say language is useful, and in implementation science, the language sometimes is awkward, but it's well defined. And what I like about it is it means that everyone has a similar understanding of what it means to some degree, with limitations, of course. So we need to find the right language that's for the sector and is approachable for everyone who want to use it. But it's very useful to have those definitions. So what's our next step with you, hopefully? So we've been reviewed we've reviewed this kind of key reporting domains. We have done this scoping review. And we want to use this as a starting point for stakeholder engagement. And I will show you a QR code at the end is for you to kind of discuss with us and join for future discussions as you see fit. But we also have a core group of organizations that have said they really want to be involved to help refine and prioritize what we include. Sorry. We then want to actually pilot test the toolkit. So we want to go to the field and do 2 or 3 pilot runs that we can see, if we do the training the way we expect, then can this be actually brought back and reported? What needs to be adapted, and use that as an adaptation component, and then finalize the document. So in the end, we have something that's usable. So what should we include? What should this document look like, right? So it might include a checklist, just like the consort guidelines. Come on in the front, Kelly. There's lots of chairs. Nice, nice. We've only worked together for what, 20 years? All right, so there might be a checklist. This line says Kelly is the worst. So it might be a checklist like the consort checklist, just something that folks will say, where are they reporting this in their protocol or whatever. And then a lot of these have examples, for each of these lines, there's an example of what we mean and an explanation that can be quite extensive, so that we have a clear set of definitions together. And then we might need tools. That might be a question for you all, like is it a standard set of tools? Are there actually not just the checklist of whether you do it, but actually like something that actually can help you populate it and it's a little bit more universal, or is that overly prescriptive? That's something that we'll want to talk to the implementers about, what makes sense. And then also the case studies, which we think will be very important to really ground truth this. Developing the case studies, so to put care, World Vision, Kelly's going to work with us on this. And also World Vision, if there's others that are interested, other organizations are interested in doing some of these case studies. So we want to try this out on some different interventions, probably multi-component interventions, to see how it works with the different kinds of WASH interventions to show feasibility. And I think the discussion question here gets back to what Mike and Lewis mentioned. So this is for the last couple of minutes, maybe 10 minutes. I'd like to talk about this. Now that you know a little bit about what we're trying to do, what do you see as the things that should be in or out based on what we want, how we scope and scale this? What subsectors are useful, whether it's household, community, non-household WASH, food hygiene, policy, system strengthening, hardware, software, professional training. What do you think? What just seems the most relevant, and what components do you think might be involved?
Yeah, I was just gonna have, I think every time we discuss this aspect, we're trying to balance simplicity on one side, which means it might actually get used and used properly, versus making it broad enough that we're not leaving out aspects of the WASH sector that could benefit from something like this. Mike, Neela, I know yesterday you were talking about your rethinking rural sanitation guidelines, and did you could have ended up developing an encyclopedia of sanitation or making something tight that might actually get picked up. There's similar challenges in any time you develop a guideline, I think.
So I think one of the things is at the moment, what's being developed is focused on trials, basically. I think some of the different types of intervention are very important, and how they might include systems, professional training, ones, and more broadly, I'm thinking too that there's much more on the political economy side that you need to consider, which is pushing this away from complexity, but to thinking about how the gatekeepers engage, how the stakeholders engage, all those different
how people were engaged and how much effort was put in on that side to make these things work and to be successful is, I think, one of the very key things. One of the other ones, which wasn't touched on before too, was about supply chains, so whether the equipment was brought into the country or whether it was available locally.
Right, just think about sort of the demand side. Who's going and looking for these sorts of things and emailing to the gas and implement evidence-based wash intervention, and where are they finding them, and when they want to get there, you know, I would sort of say, we're positing that there exists or will exist end users, we're gonna take these things together to kind of wash. Can we find those end users and find out what they want?
Yeah, and I think, I guess in my mind, you know, there are incredible implementers in the room, and they have their own internal processes, and there's a lot of institutional learning and knowledge. But I've seen in my experience, it's sometimes hard to cross communicate that. We see that sometimes in presentations here where people are trying to explain nuance, but their definitional terms are different. And so it makes it just very difficult to say, this is what worked here, and this is how you, different organization, can take that up. And so I would hope that those users are here, and it helps internal cogency within a country program of one organization, between country programs of one organization, and between country programs of multiple organizations. So that those definitional terms and that standard way of talking about it can help relay and pressure test some of those contextual components and innovations. But it's something we should talk to the folks in the field, many of which are not here.
Yeah, no, I agree. I think you do that thing, they do that thing. What do they look like at that moment?
Okay. Mike, and then Raymond and Darcy.
I think like just when I'm looking at it, it reminds me of like one of the dimensions that we have back at the practice, which is like if something in the and people start getting worried about this, we start getting worried whether or not a ship, if we don't make that ship, we won't get that out. So if somehow bridges that gap, it could be a use. Maybe, yeah, so I think that's the.
Yeah, and I will just point out that there is a place in academia for dynamic evaluations that don't, you know, but we haven't done as good a job because we haven't.
I'm not saying there isn't.
Yeah.
All I'm saying is that tension is often in conversation.
Yeah, I think though, my own opinion, part of the historical challenge within WASH is that a lot of our trials have been about health endpoints rather than about implementation endpoints. So if our focus is on implementation endpoints, we can think about more dynamic approaches to achieving those implementation endpoints. But if we're just thinking, does A affect health? It creates a more static kind of study. I do hope this is relevant to programs. I mean, most of the work that's done is not trials or observational studies. It's all the work that the governments and other folks here do. So, Darcy.
Yeah, this is more raising questions than providing answers to what you have on the slide, but I'm looking at the second bullet point for non-household wash, food hygiene. And I'm thinking about integrated interventions. So for example, if you run an IPC intervention that includes hand washing, but also includes a variety of other medical interventions, if and how do you include those non-wash components under this framework? Same thing as we think about things like transformative wash. You're improving the sanitation and providing a household water connection, but also improving the roof quality and installing flooring. If and how you include that under this checklist.
Helpful.
Yeah, just like from the demand side, as an academic, I think this would be great because I was just doing this today, right? I'm trying to do something related to another paper, and I was trying to figure out exactly what they did and all this tracing out the protocol. So this would, I would love for this to exist. But on the supply side, I mean, I think the incentives are not very strong for us to be careful and diligent. I mean, hopefully we will be, as you know, trying to contribute, but yeah, just like whatever sort of institutional support there could be, like maybe some institution that would take a first pass, right, and then contact the PI and say, well, this part is not clear, or this part needs to be filled out, or it's just the grant people would make those.
Yeah, I think that was a guideline.
Can you speak up? I can't hear you.
Where this fits in like a taboo comment, but like if an implementing organization is saying exactly what we did, there's like the ideal, what maybe I wrote down, right? Okay. Like, and then there's maybe what actually happened. And then there's competing organizations who are going for the same pot of money from USAID. And like, they know exactly how we do it because we wrote down exactly what that agreement told us to write, every single method, every single dose, every single whatever, you know what I'm saying? And I'm just worried, I'm not worried, but I'm wondering, it's just like a larger question of like, how much are, you know, of course, we all want to like solve poverty and like help the world, right? But, you know, in the grand scheme of things, we're still competing half the time.
Yeah.
Right, so.
That's very important, and I think important to think about that as a barrier, and we should talk more about how to mitigate that, because that's very real.
I'll join your committee.
Nice.
There's also the risk of donor reporting, but then the integrity of what you're doing is question.
Right.
Because of, yes, adherence or non-adherence.
Right. Yeah.
Yeah,
Yeah, it requires transparency.
and I think we need donors to be on board somewhat too.
All right, so we, just to wrap up the last thing, so we, this is a QR code. If you are interested in being part of future discussions, and this is not, we're not asking for a big commitment here, maybe 2 or 3, let's say 2 hours in the next year. If you're interested in reviewing, commenting, if you sign up, we're not going to hold you accountable, but this is just takes you to a Google form where you can say your email, who you are, institution, and we'll be in touch to run some of these things by you. And even if you sign up, feel free to say you're too busy. That's totally fine too. But we would like to have a bit to keep this conversation going. In order to continue to tap into the expertise. Do you have any final?
Just wanted to also acknowledge Emily, who's not here, who developed a lot of these slides and did a lot of the work on the literature review. So.
All right, I want to thank support from folks who've already tapped into, all of you, and from RGHI who's funding this. Thank you so much. Put this back up in case any types any more works.
Yeah, so we're, gotta know. I can tell you, we'll go paper get in and we'll get papers and if you weren't 100%, can we look it up? I think we, well, let me get the first one. Oh, it's not going to get it. I don't think we're gonna have my paper was open now.
So this is not really rationale about the study. It's the rationale of why you're doing what you're doing. I know it's remarkable. How many people do not write down rationale for why they're doing it? Why are they doing this?
Methodology.
Yeah, like no, the implementation, not the study, but the implementation. Like,